Elizabeth, I didn't know if you said something, if you were on mute or not, but I'm also really grateful to be here and I'm looking forward to talking about hormones and thermography tonight.
Definitely. I am super excited. Uh, Everyone that is here with us on Zoom and watching here live on Facebook. My name is Elizabeth, the Education Coordinator for Marlene's Market and Deli. Tonight's special presenters, we have Shanna Rivera, and then also Dr. Joy from the Mount Rainier Clinic. And we are having a wonderful presentation by them on hormone analysis. And take the floor.
All right. Hi, I'm Dr. Jennifer Joy. I practice in Gig Harbor, Washington at Mount Rainier Clinic and at CSU Health down in Olympia part-time. I have been a naturopath for about 5 years now and have a pretty wide variety of a practice with hormones being one of my specialties. I got involved with them about 3 years ago, and I'm grateful because I consider it my happy medicine. People feel better when their hormones get optimized, and I think that's super awesome. So um, anyway, so we have a whole lot of hormones in our bodies, everything from progesterone to estradiol to testosterone. Um, we also have things like DHEA. There's a whole host of them. And one interesting fact about hormones is they're actually all derived from a steroid base from cholesterol. So that's the base of all of our hormones. And um, oftentimes, due to all sorts of different things, hormones can get out of whack, and we need to do things to rebalance them. That can include very basic things like diet and lifestyle, all the way up to herbal type medicines, bioidentical hormones, as well as synthetic pharmaceutical hormones. As soon as we get into puberty, we start producing a lot of these hormones. And with that, they can get out of whack even just from the beginning. So I work with people of all ages, everything from, teenagers who are having irregular menstrual cycles all the way to postmenopausal women and men who are going through andropause, which is when their testosterone starts to decrease. Pretty cool stuff. Sorry, moving on to my next slide. So one of the things that I see conventionally with a lot of people that come into my office is they tell me that something's off. And oftentimes their regular medical doctors will look at it and they will say that everything is normal, like that, you're fine, your hormones look fine, or they won't even look at hormones. So what I do is I end up bringing people in. We do kind of a general analysis to find out what's going on. Are you having painful periods, having menstruation? Is your libido low? Is there sexual dysfunction? Are you having migraines, acne, mood swings, hot flashes, sleep problems, and all sorts of things that can be off? And then we take a look at kind of your general sense of health from head to toe and see is there anything else we need to look at, and go from there. Conventionally, what I see is a lot of younger women get put on birth control, antidepressants, oftentimes sleep aids are put in. And those are all things that don't necessarily need to happen. So yeah, as far as different things that can help, we can work with to help balance hormones are things like diet and lifestyle. And that's, doing things like eating a whole foods diet that is mostly plants, meat as a condiment, and a rainbow of colors. I'm a big fan of that. Making sure people are exercising regularly, drinking water, minimizing sugars, refined products, reducing caffeine, reducing alcohol, and all sorts of things. One of the best, so when we talk about hormones, each hormone is a totally different thing. And when we start menstruating for women, we produce progesterone and estrogen, and we have testosterone. And progesterone is one of those awesome hormones. It's kind of that cool, calm, collective hormone that I see that can oftentimes be imbalanced with estrogen. And I'm sure along the way, maybe you've heard of estrogen dominance, and that can happen early on when we get exposed to things like xenoestrogens. Those are things that they're synthetic type things that create what looks like an estrogen in the body and reacts with the body. Plastic will do that. Chemicals can do that. Antibiotics can actually have that happen. So trying to work to balance that out is kind of an important thing. As far as women, kind of in the beginning, to try to balance that, one of the things that we can do is use different foods as medicine. So things that are going to support the natural production of progesterone and the natural production of estrogen. There's things like seed cycling that can be really helpful, and different organic estrogen type foods like tofu and soybeans and those types of things. What eventually happens with women is usually sometime between 35 and 55, women go into menopause. And menopause, the true definition of menopause is when a hormone called FSH gets to be above 23 and you have no menstrual cycle for a year. But there's this period of time that often happens where that isn't happening, where you might have a menstrual cycle that kind of comes and goes. You might have one menstrual cycle and then skip a month or two and have another one. Your cycles tend to get kind of all out of whack at that point. You may end up having no cycle all of a sudden one day, and you might start getting hot flashes. You might start just not feeling well. You might start getting more brain fog, feeling more tired, fatigue, loss of libido, some vaginal dryness. And those are all symptoms of menopause that I see quite frequently. That's a good time to come and go see your doctor to find out, like, hey, is there possibly a hormonal imbalance? And is that something that we can do to, balance us out using, all sorts of things. The one thing that I think is often missed with women is actually testosterone. When testosterone drops in women, it can lead, as we get older, to decrease in muscle mass, increases in cardiovascular risk. It leads to decrease in libido. And that can also happen even before we get into menopause. I actually do a lot of hormone replacement with testosterone for women of all ages, particularly after they're done looking to have children. So seen some pretty cool things with testosterone replacement for women, which is not a hormone that we ever really think about for women. And then for men, the same actually go through andropause, and this is a point in which their testosterone starts to decrease. You usually start seeing them lose testosterone by 1 to 3% by the time they turn 40. And by the time you get 50, 60, 70, you start to see things like brain fog, inability to have erections, their libido drops, not being able to put on muscle mass, those types of things. So testosterone replacement in men is also a really important thing to consider. And I think that's highly under-recognized in the community. I'm very commonly seeing even men in their 20s with testosterone in the low 200s. The normal range for men is about 300 to 900, but you see it much lower in a lot of different men. And so it's something that I think we definitely need to address, because there's simple things that we can do for men in their 20s and 30s to support natural testosterone production, particularly using herbs. Big fan of that. When it comes to, so the start with it would be to come in, get an appointment, set it up where we go over and discuss all the different types of things that could be going on. And from there, I usually run blood work. That way we can kind of get a baseline of where your hormones are at. And I also like to run thyroid hormone. Thyroid hormone is a really great one that we can look at to determine, like, if people are having an inability to lose weight, or if weight gain is really rapid and sudden. I see this a lot in my teenage girls, that all of a sudden, like in 6 months, they'll go from what their healthy weight is to gaining like 30, 40 pounds all of a sudden. And so I think that sometimes that gets missed by conventional doctors. And so it's always good to look at thyroids for that. But then also for energy and, people who get anxious or have heart or chest pain and palpitations, looking at hormones, particularly thyroid hormones, really important. So we do a workup there, and then we go through them, look at what might be imbalanced. I usually like to start with kind of that dietary lifestyle thing, encouraging exercising, drinking water, getting good sleep, providing different very specialized treatment plans for nutrients, For people, zinc is really important in hormone production. So are your B vitamins, looking at people to make sure that they don't have what's called a methylation issue, the inability to process B vitamins, adding things in like flax and fiber, and fermented foods, cruciferous vegetables are really great. Those are things like broccoli, cauliflower, kale, Brussels sprouts, really supportive to the liver to help with metabolizing hormones that can get kind of upregulated in a not so great way. The next step I usually look at for people is looking into herbal replacement, herbal support. We have some really great herbs out there that can be helpful. Vitex is a great hormone balancing herb for women, as well as things like horny goat weed to support testosterone production. Tribulus, milky oats are great. I love maca for people. DIM is another supplement that I use often to help balance hormones. And then there's some really great formulas out there from a lot of the different companies that support natural increases in both testosterone and testosterone production. And then there's things like biphasic formulas. Those are formulas that during part of the cycle when your estrogen is supposed to be high, it supports the estrogen. And then the second part of the cycle where progesterone is supposed to be high, it can also support that cycle. So really kind of a nice thing. As we get older and want to get more aggressive with hormones, if it's causing a lot of these hot flashes that people aren't feeling very well with, or having night sweats, not being able to sleep, working with brain fog is a huge one. We might consider doing something like a compounded hormone formula. I work with several compounding pharmacies to do things like troches, which are little kind of gel things that can dissolve in the mouth, as well as topicals. You can make topical creams out of all of these hormones. They also make bioidentical pellets, hormone pellets that actually they're these little pellets that are compounded with either estrogen or testosterone that get compounded with stearic acid that can actually get inserted underneath the skin and give you hormones for 3 to 4 months for women and up to 6 months for men, which is a really awesome form to give it to people. It's can be really great because then you don't have to take something or do something every single day. It's something that kind of is a long-lasting thing. All of those options are really, really great options, and they're very individualized by the person. Benefits of like creams and troches is the dose is very adjustable. They're very cost effective. You can do a lot of different combinations with them, which is great. As far as pellets, they're nice because you set them and they're done and you don't have to worry about it every day. The one downside is you set them and they're done and they're there for 3 to 6 months, depending on the person. So they all get absorbed at different absorption rates. And the other benefit of doing something like more frequently, like the troches and drops and topicals, is that you're giving this constant supply. There's a little up, a little down. I know a lot of people really like that versus a pellet where it's just going to go straight up. You're going to have this high dose and then it's going to decrease over time. A lot of hormones, one of the other benefits for them as we get older that I really like is that it can help support the cardiovascular system, help support muscle mass for both men and women. And it actually, once we lose hormones, we start to lose our bone density. And so doing some sort of hormone replacement is really important to make sure that our bone density stays nice and strong so that we're not looking at osteoporosis later. Other benefits that are kind of not well known is that hormones actually help with pain. So I actually have a lot of patients that their pain goes away from like minor arthritis and things by getting on hormones. I'm often able to get people off of their like SSRIs, their antidepressant medications once we balance out hormones. And another supportive thing is that hormones are very supportive to the immune system. All of the hormone balanced patients that I've had who've recently gone through a lot of these viral infections have actually done very, very well if their hormones were balanced versus those that weren't. So that's a great thing. There's also pharmaceutical options for hormones. They do make pharmaceutical estradiol patches, which just sit on the skin and that can get absorbed through the skin, which is kind of a nice option. It kind of gives you similar benefits to the pellets, except for you can take them off if the dose is too high. We can adjust that a little bit more easily than a pellet. And then for men, they actually do testosterone injections, which is kind of a common, well-known thing. Injections kind of they kind of spike you up a little bit like a pellet, but it's kind of a more frequent thing. You have to do them once or twice a week. And so for people who are kind of fearful of needles, sometimes we shy away from that. The one thing with the testosterone injections and the estradiol patches is sometimes insurance does pay for them, which is kind of a nice option for people. The other options are usually out of pocket as well. And let's see here. But yeah, overall, working with hormones has been a really great thing for a lot of my patients. They just generally feel better when they're on hormones. A lot of people ask me, are they safe? And the answer is yes, they are, especially for working with bioidentical hormone replacement. So what bioidenticals really means, bioidentical is exactly what the molecule that is in your body looks like. So they usually get derived from soy or yam, and that molecule then gets turned into whatever application we decide to do with it. The thing with bioidenticals is they cannot be patented. Anything that comes from nature is not able to be patented. And so that's where actually hormones are currently kind of on the chopping block with the FDA. They're trying to take them off of the compounded market and make everything pharmaceutical. And so this is something that's really, really good for people to know and have that out there, is that we're working really hard. Different doctors who do a lot of hormones, including some of the different companies that do pellets, are really working hard to get the FDA to realize that these hormones are safe, because there was a study done in the 90s, the Women's Health Initiative, that had come out that essentially had said that a lot of people were dying from hormones. The problem is that they were doing the study on equine estrogens that are derived from horse urine and synthetic progesterone. Synthetic progesterone actually does, in combination with that estrogen, increase the chances of getting breast cancer. But natural progesterone, which is the bioidentical kind, which also does commercially available in a capsule that you can get from the regular pharmacy, does not cause that increase in risk. And what they're actually finding is that women and men who are on bioidentical hormones actually do decreased risks in getting these cancers, the reproductive cancers. And I think that's really important for people to understand that the synthetics, or at least the synthetic progestins, are the ones that don't do the same thing as the bioidentical with progesterone. So I get that question a lot, and I'm very confident to say that I'm not worried about any of the people that I put on hormones as long as they're on a bioidentical. So that is definitely a very common question. And then kind of just switching gears just a little bit, one of the other things that my clinic does is colon hydrotherapy. And Gail is one of the colon hydrotherapists that used to work at our clinic, and she's unable to do attend today. She recently had moved to Arizona and asked me to speak just a little bit about colon hydrotherapy. So what that is it's a therapy that essentially we have a colon hydrotherapy table where people come in and they come and sit, lay on it, and you personally insert a small tube into the rectum where it goes and flushes the colon from the inside out. It's a really nice, gentle cleanser to clean out the colon. We use it for all sorts of stuff. One of my favorites are for people who are getting constipated frequently. We also use it as just general cleansing. Oftentimes what can happen is in the colon, if people have any constipation or are not having bowel movements once a day, which is kind of a minimum. And oftentimes people don't realize that they should be having bowel movements once a day. It's not uncommon for my patients say it's been 2 or 3 days since they've had a bowel movement, or up to a week, which I'm sure is very uncomfortable for them. And what can happen is there's what's called these rugae, and they're like these little kind of indentations in the colon, and that fecal material can get backed into them, and then mucus can kind of get backed over the top. And so you can have this fecal material that's stuck in the colon for a long period of time. With colon hydrotherapy, it goes ahead and flushes that out gently. It's kind of like an internal water cleaner massage. Very, very helpful. I see great results with everything from, feeling better, gas, bloating. It helps with the constipation. It helps a lot with even things like skin, because it helps just get all of those toxins out. It takes the burden off the liver by getting all of those out. And so we do colon hydrotherapy there. I recommend people just even to do a series of 3 of them at some point in your life, just to kind of support your system. So it's definitely a great therapy. I could tell you hundreds of stories of all sorts of great things that have happened, but generally speaking, my personal experience in many of my patients is after a colon hydrotherapy session, most people feel better. You can even lose up to a pound or two from it. That's not meant for weight loss, but I've seen people just feel lighter, helps clear up skin, helps you just feel better. And it's definitely part of my regular treatment regimen for a lot of my patients, just for wellness. So that's a little bit about colon hydrotherapy. So yeah. I guess I'm kind of at the end of my portion in time. So I thought if there were any questions or any clarifications I can make, I'd be happy to answer those now.
Wonderful. Thank you so much, Dr. Joy. Let's see here. So folks, you're welcome to unmute yourself to ask questions or enter it in the chat box. Oh, Holly.
My question is about testosterone in women. You said what the range was for men. What is the range for women?
Normal range is about 5 to 48 on LabCorp testing. So the average kind of premenopausal woman usually ranges somewhere between 17 and 40. Once we get above that 50 range, we might be looking at a condition called PCOS. Once you kind of get below 5, you don't have testosterone, and a lot of those things can happen. But I usually see most postmenopausal women, they might make a little bit, maybe 5, 6, but usually it's less than 3 is what I normally see.
Okay, and if I can ask a second question.
Yeah.
I am 65 and I was on bioidentical, but I was doing pig for my thyroid, pig thyroid.
Mm-hmm. Yep.
Is what I got given. And I was able to end up kind of actually feeling when I could start tapering off with it. And then I haven't taken it about a year. And, you know, I have a lot of hair loss. My daughter has PCOS. But my doctor at this point said at age 65 that she recommends that I not go on it. Are you treating people with bioidentical like in their 60s and 70s and 80s?
Yeah, absolutely. I consider preventative medicine, particularly for cardiovascular disease. It also can help to keep your cholesterol in check. It can help with insulin resistance, with diabetes, all sorts of things. So I do treat all ages. I've got a really cute 80-year-old couple that have been getting bioidentical pellets for the last 15 years down in Texas, and have moved up here, and they come in every 3 to 6 months to get their pellets because they want to live longer to be with their grandkids. So I definitely do that, and I find it very helpful. I mean, we weren't originally supposed to live as long as we did, and our bodies kind of turn off that production. And I just don't think women have to suffer through all of the, all of this stuff, like, vaginal dryness, making it really hard to connect with your partner to be able to have intercourse, and, just feeling off and getting depressed and having brain fog, like all of those things you don't have to go through. We can fix that with hormones. So hair loss, you'd probably looking more at, the thyroid as well. So yeah, definitely some hormone balancing would be great. And I think that's something you should consider looking into.
Thank you.
Yeah, absolutely. Thank you.
Any more questions, folks?
Anybody?
Well, I'm going to check Facebook here. I don't think there's any questions here. Doesn't look like it. So, thank you so much, Dr. Joy, for your expertise. And that's so amazing that they're able to put it into little tiny pellets. Make it easy.
Yeah. It's really kind of fun actually. And you know, it's not for everyone, but it's definitely an option, and there's lots of different options. So it's just kind of finding, have to kind of look at what's going to make the most sense for each person. And the other thing that I do like to mention is that if you choose one option of hormone replacement, you can always try another one later. It's not like you're stuck in one sort of hormone option. You know, if you want to try creams first, or if men want to do injections and then they try pellets and they don't like them, they can always go back to any of these other options. So the sky's the limit. You know, you can integrate herbs, all, you know, diet, all the things. It's just getting started and working towards feeling better.
Oh my gosh, someone commented on Facebook and said, oh, there's so many of us that can benefit from this. So someone is very grateful for your presentation. So
Oh,
thank you, Dr.
thank you. And then I guess there was one additional question I see on the chat.
Yes.
So progesterone actually doesn't come as an injection. It comes as a topical and a capsule. So you can get it as a, you can get it commercially available through the pharmacy, and it's just progesterone. You can also get it compounded into an extended release to help with sleep at night. I use it a lot for sleep. And then you can, unfortunately, you can't get it as a pellet. Progesterone is very, very fluffy. And so they have a really hard time compounding it. So it gives an extended release as far as a pellet's concerned. But testosterone, maybe I glossed over that one, but testosterone injections are going to be from the pharmacy, and those are going to be usually prescribed via, you know, everything from Rite Aid to, you can even get it at your compounding pharmacy too. But yeah, so hopefully I answered that question. Okay.
Thank you so much, Dr. Joy. And thank
Yeah.
you. Thank you, Ava. All right. So Shanna is our next presenter. Shanna, would you like to take the live stream floor?
Absolutely. Thank you very much, Elizabeth. And I wanted to go ahead and show a slideshow tonight, if that's all right with everybody. Do I just share my screen?
Yes.
I think so. I think we're good to go. Awesome. All right, everybody. So my name is Shanna Rivera, and I am a certified thermographic technician. It's a fancy title, right? But basically, I'm an infrared imaging photographer or a medical thermographer. A few different titles there. So for thermography, you can identify if somebody has hormonal imbalance, possibly with thermography. So we say possibly because we cannot diagnose what is going on with these images. You have to go for further testing and work with doctors like Dr. Joy to figure out what exactly is the imbalance that we're seeing. But tonight we're going to go over hormones and thermography, and you're going to see a lot of case studies, and I'm excited to show you this evening. I wanted to say thank you so much to Elizabeth and Marlene's Market for getting us all together tonight. I'm really happy to be here with you guys. All right, so there's definitely a lot to cover. If you have any questions at all, please go ahead and type those in the chat box, and I'll try to save a few minutes at the end of the presentation so I can answer any questions you might have. So this is me. I primarily service Washington State. I'm actually from Massachusetts, and I've lived in a few different places, New Hampshire, St. Thomas, the USVI, South Carolina, Florida, and now I'm in Washington. So I am the founder of Flowell. Flowell is my business. And I'm a certified thermographic technician who has been trained through PACT. PACT is the Professional Academy of Clinical Thermology. And I'm also a professional member of Breast Thermography International. So at Flowell, we travel to all these different states. So please keep these states in mind, because quite often as you go through this presentation with me and you see these slides, you're going to think of family or friends, you know, loved ones in other states that could benefit from medical thermography. We have a very generous referral program as well for those who refer to us. Tonight, I have a question for everybody. You know, when was the last time that you had your hormones evaluated? You don't have to answer right away, but if you want, you can post in the chat box, or you can just think about that as I go through this presentation. So medical thermography, you know, what makes thermography so popular? As members of Breast Thermography International, most of our patients find us because they're looking for a breast screening. They end up telling me that they're fed up with screenings that radiate the body or compress the breast tissue. If you expose yourself to too much radiation, it can literally cause the disease that you're looking to screen yourself for. So with thermography, not only can we check the breasts, but we evaluate the entire body, including looking for any signs of possible hormonal imbalance. Hormonal imbalance or toxicity in the body can lead to cancer and other diseases. So it's really important to know what's going on in your body. And here are some of the stats that we have tonight for you for breast cancer in the United States. 1 in 8 women develop breast cancer in the US. There's currently 280,000 new cases of invasive breast cancer diagnosed every single year. There's over 40,000 deaths every year from breast cancer. 80% of breast cancer patients do not have any family history. So quite often I get a call and someone saying, you know, my sister or my mother was just diagnosed with breast cancer, and now I need to come see you. Well, if 80% have no family history, that means everybody should be getting this safe screening tool. By the year 2030, it's estimated that there'll be over 440,000 new cases of breast cancer every year. And it's not just women, 1 in 833 men are diagnosed with breast cancer in the US. And so it is an important screening for both men and women. I don't know if anybody knows exactly what cancer is, but you know, it's the uncontrolled proliferation of cells in your body. All of us have cancer cells in our body. It's just normally our immune system can keep them in check so they don't grow and mutate. If they are able to do that, though, they double on average every 90 days, or they grow, they become hotter. So they go through this process called angioneogenesis, where, you know, this is a picture of a vein, and these little free radicals here, they float around, and if your immune system's down, they're able to latch onto a blood supply and feed off the blood. Their preferred food is sugar. And then a tumor grows. And so as it grows, it's getting a blood supply in that tumor, becoming bigger and bigger, doubling on average every 90 days. And our blood is hot. So that is why we use thermography to identify if there are any abnormal heat signatures in the body that could indicate a sign of cancer, other diseases, toxicity, or hormonal imbalance. So to give you an idea of thermography versus mammography, in many cases, you can identify cancer when it's only at 256 cells with thermography. That's when it could be picked up on thermography, versus, you know, years later when it's over 268 million cells. That's when it can be identified on a mammogram, when, you know, there's a physical tumor that you could actually see on that test. So the different screening methods out there, you know, anatomical testing, there's mammograms where the photograph of the breast is taken with X-ray. Ultrasound is just sound wave imaging. It's actually safe for adults. And MRI is magnetic imaging. If you get it without contrast, it can actually be therapeutic for your body. And then thermography is high resolution infrared photographs or thermal images of the heat signatures of your body. So mammograms emit ionizing radiation. They can be painful. 80% of biopsies come back negative when a mammogram says something needs to be checked out by a biopsy. And 20% of the time they're false negatives, meaning there is cancer present 20% of the time and it is missed. Mammogram guidelines are currently being challenged at this time. They're saying that it's too much radiation for women in their 40s, and they're trying to bump it up to age 50. And they've actually done so in Canada. They made that recommendation in Canada. And then to compare thermography, it can be breast cancer detection. We also evaluate the carotid arteries with the cerebrovascular screening. We look at hormonal imbalances, spine analysis, look at the different varicosities in the body or the veins that stand out. And you can also identify if there may be any nerve issues. So with thermography, it detects your physiology instead of the anatomy, the heat instead of the, looking for something physical that you can see in an anatomical test. It detects cells that are not dense enough to show up on an X-ray or a mammogram. There's no compression and there's no radiation. It's actually safe at any age. Our youngest patient is my son. I scanned him when he was 2 months old, but and that was just in January. But before him, it was a 2-year-old girl was my youngest patient. And the oldest patient that we have is 96. So at any age, you can benefit from knowing what's happening in your body thermographically. So here are some case studies that I have for you tonight. These slides are presented for educational purposes. We do show some normal slides and some are extremely abnormal. So, just keep that in mind as we go through these slides. This is a thermography scan of a gentleman, and he is presenting with mottling patterns. Mottling patterns are indicative of toxic buildup in the body or hormonal imbalance. If you have them in your thermography scan, then it's a great idea to ask your doctor what's right for you in detoxing and how you can go ahead and evaluate your hormones. So some of the many methods are blood work, saliva, urine analysis. There's different ways to pinpoint, okay, so I have mottling patterns in my thermography. Now what? Is it the hormones? Is it toxicity? What can we do to balance this out? Because we want to see improvement at the next scan. This is a picture of a woman that had a hot flash while she was having her thermography. Having hot flashes is a symptom of hormonal imbalance. You don't have to suffer with them. I think Dr. Joy had brought that up in her presentation that, talk to your doctor or book a consult with Dr. Joy if you are feeling a lot of hot flashes. It's not something you have to suffer with. If you do have one when you're acclimating for your exam, please let your technician know because you'll have to acclimate further. Acclimating for the exam, basically you hang out naked in a room for 10 minutes because your clothing holds a heat impression on your skin and we need that to dissipate. So after the 10 minutes or so, that's when we can begin the imaging. But if a patient has a hot flash, we have to start that acclimation period over again. So these are signs from mottling patterns on a male patient, and you can see all these spots in his face and his neck. They're called mottling patterns. They also could be indicative of oral inflammation, oral infection. It could be an abscessed tooth, a root canal, other toxicities, issues from TMJ. The list goes on, and what it can be, something from injury. Let's see. So if there is an imbalance here, you do want to work with a holistic dentist ideally and your doctor and figure out how you can reverse these heat signatures. Also, his ears and his nose are too cold. They're black. They should have better circulation than that. You can also see some of his hair and the wall behind him are black, and both do not have a blood supply. His ears and his nose do, so they shouldn't be so darn cold in contrast, to the hair and the wall behind him. So know what your heat signatures are so you can be proactive in getting rid of them, and hopefully before there's a diagnosed issue. So for this patient, number one, I would again encourage him to see a holistic biological dentist to clean up the mouth. You can really see on the right here, which is, I don't know if you guys can see my mouse or not, but this image on the left, all these red dots here start in the mouth. There is some oral inflammation on the left side of his face as well. And then it kind of can leak down and pool in the neck and form these mottling patterns. But you really want to figure out what is happening in the mouth and how to clean that up. It could mean extracting a tooth, it could mean replacing a infected root canal. The list goes on what you could do to clean up the mouth. Just step up your oral hygiene, step up that routine, and really learn from ideally a holistic biological hygienist on what that means and what that takes to have optimal oral hygiene. And then once you do that, then you can do some lymphatic work and dry brushing. You could bounce on a mini trampoline, sweating, working out, eating clean. You could use Beamer. Beamer is a medical device that improves your circulation by 31%. There's a lot that you can do to clear this out, but if you do have anything going on in the mouth, you want to take care of that first, because otherwise it's just going to keep leaking down and affecting not only the neck, but the entire body. So all those other things I mentioned you want to do after you figured out what's going on in the mouth. These are some female mottling patterns in the breast. These are mottling patterns with normal temperatures. It's very important to monitor as recommended. So every report that we send out, it has a recommendation for when to follow up. It could be 1 month, 3 months, 6 months, or a year. And her follow-up was recommended at 6 months. Because cancer doubles on average every 90 days, the goal here would be for her to get a year follow-up at her next recommendation. But ultimately, some of these red spots on the body that, we want to keep an eye on in 6 months' time, we hope that they've remained the same temperature or better with lifestyle changes and possibly balancing out her hormones. We see these numbers go down. So what we look at is the difference in temperature, or this delta T average, from the right to the left side of the body. And by doing so, we can let a patient know if this number is within or over normal or abnormal limits. And I can tell you for both of these numbers, the threshold is 2 degrees Celsius. And so these numbers right here, the difference in temperature from zone 1, zone 2, 0.56, just take the absolute value, well below 2 degrees Celsius. Same thing here. But, our interpreting doctors didn't like how hot this spot looked. So they'd said, come back in 6 months. We want to make sure everything looks good then. And then we'll see you back in a year again, is hopefully what we're going to see on her next report. Okay, so some more female mottling patterns. These ones were someone that improved. This is what I live for as a thermographer. I absolutely love going over reports when I get to see patients improve. So this top scan, you can see her mottling patterns, these dark spots on the black and white image. It's called an inverse grayscale palette versus the rainbow palette. You can best see heat and color. And look at her armpits. The armpits also reduced in heat, the mouth and the neck, underneath the breasts, and then these mottling patterns that she has on her follow-up scan down here, April of 2021, look how much lighter they look. So this is heading in the right direction. This is ideal. I think if she continues on with the lifestyle changes that she made, she could even get those mottling patterns to go away completely. You can monitor your progress of your hormone replacement therapy with thermography. Is it causing too much inflammation in the body? If so, you want to discuss any symptoms you're having with your doctor. I think, like Dr. Joy said, you're not stuck with one hormone replacement method. There's many different kinds out there that you can choose from, and you want to make sure you're using one that is right for you. So I recently went over this report with this patient, and she, this is her baseline scan with me. This is her follow-up. And you can see the armpits improve. There's less heat there. That makes me happy. The armpits can show trapped toxins in the body. And so you may need to change up your deodorant, or you may need to sweat more if that's the case. But the main difference that she said from this scan to this scan was that she got on hormone replacement therapy. I can't recall which kind she got on right now, but she's not pregnant. So sometimes the vascularity like this can indicate a woman is either pregnant or breastfeeding. And so it's kind of alarming to me, the increase in vascularity here from this scan to this one. So I encouraged her to ask her doctor about ultrasound imaging to compare to this thermography, and really figure out what's going on here, and then determine, is the hormone replacement therapy that she's using the best option for her, or should she switch it up? So she's going to talk to her doctor about that. Here are some pregnancy patterns. This woman was pregnant here. It was a month, 1 month pregnant in April of 2020, and then 9 months pregnant in November of 2020. And you can see the increased vascularity, which is totally normal for a pregnant woman who's gonna, be producing milk soon. But the point of showing these slides is that many women are pregnant or nursing, in some cases for a decade of their life. And so it's really great to utilize thermography as a safe screening method to analyze the heat signatures. The temperatures, I don't have them listed here, but I know that they were all within normal limits. All these little circles that are drawn on the body, our software is able to calculate temperatures, and then in the report, they tell you whether they're normal or abnormal. Here's some images of some fairly normal breasts, not a ton of mottling patterns. I think I remember telling this patient, if this were me, I would want to keep an eye on this spot, and in other images, our interpreting doctors took those temperature readings, but ultimately pretty normal here. And then this is kind of an abnormal image of the breast. This is not breast cancer, but definitely something we want to keep an eye on, this big red heat pattern that goes all the way down into the left breast. Here are some tight bra marks that we have on this patient. This is something that you can really see this line right here. And I see this often on men as well in the waistline. If you have any clothing that's really restricting on your body on a daily basis chronically, it creates lymphatic congestion in that area. And when you have lymphatic buildup in the body, it creates toxic buildup in the body, and toxic buildup that festers over years or decades could lead to cancer or other diseases. So it's a really good idea not to wear clothing that's too tight for you. If you get home at the end of your day and you just can't wait to change your clothes, get into comfy clothes, that may be a sign that the clothing you're wearing during the day is not fitting you optimally and you want to change it up. There's a book out there called Dress to Kill, which talks about in societies where women wear bras, breast cancer is very prevalent. And in societies where they don't wear bras, there's about 0 breast cancer. So something to consider with your wardrobe. Here's oral inflammation that improved dramatically, as well as the inflammation over the thyroid decreased. So a lot of my patients who tell me they're on thyroid supplementing or medication, I ask them, what's going on with their oral health and guide them to a holistic biological dentist to get that cleaned up. If there is anything going on in the mouth, the first stop is the thyroid before it gets into the rest of the body. So if somebody wants to get off of thyroid medication, I always encourage them to work with a holistic dentist and talk to their doctor about that option and how they're analyzing their thyroid. This is an extreme case of the cerebrovascular screening that we offer. This gentleman ended up passing away from a stroke. I've never seen, this isn't my patient, but I've never seen a patient who has a black forehead. You can see right there, it's black, very cold, and in your anatomy, you have your carotid arteries on your neck that the blood supply goes up into the brain through veins that rest on the forehead here and here. They're called branches of your supraorbital artery. So therefore, if one side of the forehead is colder than the other, it could indicate possible carotid artery blockage on the same colder side. And so that's definitely one of the best screening tools that we have, is to, if you can catch that early, somebody might be able to avoid a stroke. So that could be huge. We even scan children. This is a young boy who his spine inflammation improved. You can see, he went to a chiropractor after 12 sessions, got a scan again, and he no longer has red in his neck. And you can also see this right hip looked out of alignment, and now they look much more even at his follow-up scan. The bottom of the feet, tell us a story. For the full body scan, we scan from the bottom of the feet to the top of the head. Are your arches inflamed? Is just one arch inflamed? This gentleman, it really stood out to me, his right ankle. And I said, did you ever have an injury there? And he said, no, I have not. And then I saw him a few weeks later and he said, you know what? I ended up spraining that ankle on vacation and I couldn't walk for 3 days of my vacation. So had he really knew, if he knew to look into this thermography with somebody who does body work, chiropractor, rolfer, physical therapist, perhaps they could have adjusted his ankle so that it would have avoided the sprain. So thermography is wonderful for really analyzing the entire body. This is the thermography process that we have. So we have intake forms that you fill out, which include learning about our important patient protocols. You come in for your scan, you acclimate, basically stand in a room naked, and then we do the imaging. It's very quick. It's painless, it goes by really fast. And then those images get sent to our interpreting doctors and the results are ready anywhere from 3 days to 2 weeks. So people can ask for them to be expedited. And then you schedule a consult with your doctor to go over the report. And I would be your second review or your technician and make sure all your questions are answered. These are the different screening types that we offer. We also donate to the United Breast Cancer Foundation because they have a pay it forward program for our patients. Sometimes patients apply and they are approved for $150 towards their thermography. And there's also ways to save on thermography. If anyone wants to sign up tonight, you can do so on my website. It's flowwell.org. And I'll go ahead and put that in the chat box to everyone. But basically you would save $50. If you sign up tonight, you just put in the code EVENT50 off and you get to save on your next scan. And that's the end of my presentation, everybody. So I hope that you move towards optimal health and away from disease with thermography. Thank you so much.
Thank you so much, Shanna. Yay!
You're welcome.
I know that I had a wonderful experience with you when I went and got my scan. Oh gosh, that was about 2 months ago now.
Time flies, right?
Sure does. And got some I did the full body scan as as you know. And yeah, it was really eye-opening to see my body, because it's like you feel your body, but to be able to see it and like the different temperatures and in the different areas, it's really intriguing. And it's helped me now to get on the path of health more than ever. Now I have an ultrasound scheduled, and I'm going to get to the bottom of some things. I have a lot of breast cancer in my family, but like Shanna said, 80% of people have no family history. So it could happen to anybody. And so I think prevention is best. And it was a pleasant experience. Shanna is very kind. And yeah. And it kind of feels like a little photo shoot.
Pretty much.
I'm good with it. Yeah, exactly. So thank you so much, Shanna, for sharing your expertise. And
You're
also
welcome.
thank you so much, Dr. Joy. Is there anybody that has any questions? At this time, you're more than welcome to ask our lovely experts here. And Shanna had entered in the chat box the discount code, right?
No, I forgot to do that. And then someone private messaged me and asked for me to show the pricing again. So that's why I brought that back up. But
Oh, perfect. Yes, and the prepayment plan option is fantastic. That is just super cool because you can plan ahead. So you know, you could schedule out with Shauna here, and you can just be like, oh, hey, like I get paid every 2 weeks, so I'm going to throw this amount of money on it. And it's definitely worth every penny because you get a visualization of your health.
It's my motivator to do all the things I do for my health.
That's
And
fantastic.
I use it a lot, actually, with a lot of my patients, and I love it. It's actually one of my favorite screening methods for a lot of my oncology patients, because we can actually do these images really frequently. We can see progression of treatment, which is great. So you can actually see like kind of real time what's happening with breast cancers, where like you're not going to go get a PET scan every month or every 3 months. So this is like a great tool for both like prevention, especially since you can catch things so much earlier or monitor it. And then, you know, if there is a disease process, we can work to fix that and also keep a really close eye on it. I have a lot of patients that don't necessarily want to go through conventional treatment. And I encourage both using natural and allopathic methods in breast cancers and all cancers. I think that we can do a lot of different things, but if I've got a patient that says, I'm not ready for chemo, I'm not ready for radiation, I want to just kind of take a little time to think about it, this is a really great tool for them to be able to do, to, you know, see what may or may not, you know, if it's progressing or not. And also the prevention is so key, and that the mottling patterns, all of that. So I'd highly encourage people to use this, particularly for prevention, but there's a lot of really great things that it can do. So thank you so much for your presentation. That was wonderful.
Same to you. Yes, thank you.
And thanks for everyone for coming.
I know.
Thank you, everybody. So if you have no questions, we are going to say goodbye to all of our Facebook Live friends. So thank you so much.
It looks like Holly has a quick question, if that's okay.
Oh, no, she was doing the clapping
Oh, okay. I thought
emoji.
she was
Yay!
raising her
Isn't that
hand. My bad.
No, don't worry. See, is it? Woohoo! And then we have this one. Yay! Well, thank you everyone for tuning in here on Facebook and also here on Zoom. If you'd like to get in touch with our lovely presenters, I have their information in the description of this live stream video. So thank you so much. Goodbye,
Thank you,
Facebook
Elizabeth.
Live friends.
Bye.
Bye, everybody. Have a great night.